I would say every hospice situation is very unique, but generally the biggest fear I hear from families is their fear of hastening a death or harming the patient with medication. So families don't want to feel like they're responsible for a bad outcome for their loved one.
When I first interact with a family member about their taking care of their loved one, I often ask, have you ever done this before? If a family member has never taken care of someone like this, I tell them, we'll be there for you. We're always a phone call away. There's always a nurse who's up at night, and we'll be there and we'll figure out how to help you in the situation you're in and help your loved one.
Some of the emotions that I see at the very beginning with caregivers are just a general feeling of overwhelm, some anxiety, definitely some fear. But if we can help assist someone through emotional support or education to gain the confidence that they need, just to know that really whatever they're doing is amazing work.
Typically, education is extremely helpful, and we like to explain all the medications in great detail, what they might be used for. We do explain to each family that patients don't necessarily need to take these medications unless their symptoms warrant it. And our goal is always to control symptoms, but allow patients to, be awake and alert and enjoying as much time with their family or doing things they love as long as they can.
When a family member is afraid to use morphine, I just ask them to trust me and let's just try this one dose. Just try this one dose and I'll call you back in an hour and we'll see how that worked.
Caregiving can absolutely be exhausting. Sometimes people have a hard time asking for help or accepting help. And if we can gently approach that, and as social workers, we can do some of the reaching out for them and just kind of like help them open their eyes to the other things around them. Just always being there to help them identify what could be the best thing at the time.
And then sometimes it feels like you just come in one day and you can just see it. They're not asking those same questions. They're saying, I did X, Y, and Z, just like you said. Here's how it worked out. She's feeling much better. You kind of can see that transformation from fear to, I'm pretty comfortable. I can take care of this.
My hope is that families understand that hospice isn't just for the last 2 weeks of life. If we get in there early, we can help them so much more with the journey. We can help them with legacies, memories, accepting, telling people that they love them.
What do I hope that every family understands about hospice? For caregivers or people in general, understanding that hospice isn't scary, that it can be quite wonderful and a really beautiful experience.
When a patient chooses hospice, they're choosing to embrace the quality of whatever time I have left. And that change in philosophy can be quite powerful for families and patients.
Everyone is so unique and individual, and that's what's so great about hospice is that we really can tailor the situation to each specific patient and make it exactly what they want it to look like. We try to make this successful for both patients and their caregivers.